Good morning.
Good morning, Odell.
Good morning, Lisa. So I'm here with my dear friend Leisa Bryant, and a dynamic leader in the healthcare food service industry. Lisa, if you could share a little bit about your history and your role with AHF.
I've been a member of AHF for maybe about a little bit over 10 years. I've been on the board for a little bit over five, and this year I am the immediate past president of AHF. And for those who don't know, the Association for Healthcare Food Service is the premier and the first choice for all professionals in the healthcare food service industry for self operation.
Wow, that is awesome. And so, Lisa, if we could look at where you think our industry will be in within 5 years, what's your thoughts on that?
When I think about healthcare and senior dining, especially in the self operated space, in a couple of years, let me go back a little bit.
Okay.
We are seeing a transformation in the healthcare space, both for technology, both for dining, as well as customer service and hospitality. So when you blend all three together, you create a mecca of this is not your mother's or your grandmother's experience in the hospital. So I am one for food is medicine. So I believe the dining experience in healthcare is way beyond serving a meal. It is where you're feeding and nourishing
Mm,
someone. The nutrition and the nourishment, both socially, spiritually,
mm,
it's that thing that makes that person feels at home because no one wants to be in a hospital.
mm.
No one wants to be in a hospital. So while they're there, they're in that vulnerable state. And it's really up to us leaders and innovators in the food service space to ensure that dining experience for that patient is everything.
Mm,
Compassion, safety,
mm.
quality, and it's nourishing. That's number one.
Wow, so that's awesome. So I got a little bit of your passion.
Yes.
So can you delve a little bit deeper into your passion and why you do this?
So, as a registered, well, if you can guess, I'm a registered
Okay.
dietitian. So, as a registered dietitian, I will repeat myself: food is medicine.
Okay.
There's clinical outcomes that are tied to nourishing a person that is in the hospital that is not healthy or is experiencing a disease, and they need to help use nutrition as one of those interventions.
Hmm.
I am also a businesswoman.
Okay.
I will say that. And the healthcare food business, it's a business.
Hmm.
So we want to look at how can we best meet the needs of that patient within that thing that the C-suite tells you do more with less, as well as it's really a service industry, meaning that it's human connected.
Mm.
So how do we provide top service? It's employee engagement. It's how do you use employees to elevate the experience and understand the compassion when they serve that meal at that encounter for that patient. So it's all about innovation and technology. It's all about culinary and great food.
Hmm.
It's about clinical outcomes from the dietitian perspective and great compassionate service.
Wow, that you got me fired up right now, and this is good stuff. If you had your magic wand um, from the healthcare food service industry, what would you do? You had your magic wand.
So let's talk with what that managed magic wand will solve.
Okay.
Because as a food service operator, we're looking for solutions for the everyday challenges that we face. One of the biggest challenge is labor.
Labor.
It keeps us up at night. There's
Yeah.
no question about it.
Yeah.
We don't have that availability of skill that really want to enter the industry because I will tell you, food service is back breaking work.
Yes.
It's physically demanding. And we don't find many people who just wake up one day and said, I want to be in the food service and hospitality industry. So for them to really be in a part of that industry, we have to make sure that we are providing an environment that is going to be well-being, create that space and they're passionate about. So we want solutions that's going to be innovative in terms of if we can't find the staff and the labor, we have to create technology. Like, for example, I would say for example, how you're going to deliver parts. Are you going to think of robots
Wow.
to help support that element of that lacking of labor? Are you going to think of robots to support the skilled chef? Are you going to think of equipment that's going to support and expand or allow a cook two to practice at a cook three or even a sous chef level with that technology? So we want to make sure those things are happening to elevate that experience and to help to solve that problem. The other piece also is culinary, the quality food, sustainability. Are we doing enough to sustain our environment and sustainable using sustainable practices? So we want to ensure that the dietitian as well as the chef, that they're on the same page, that they're aligned, and they're aligned also with the last piece, which is the human experience. It's not just for the staff, but it's also for the patient's experience. So we want to make sure that patient feels taken care of, cared for. They're at that stage where they're vulnerable.
Yeah.
They are facing challenges for their health. So we want to make sure that quality food meets, nourish them, provide them that comfort of home, of feeling valued and cared for. And the same thing for our staff, that we're providing that psychological safe environment for our staff to thrive, because a thriving staff will also ensure excellent care for your patient population.
Wow. You know what, Lisa, you just got me fired up, and I'm excited. And thank you so much for taking time out of your busy schedule to sit and talk with me. I truly appreciate you.
You're welcome. Anytime. If you ever need me again, I'm here to chat about it. I'm a chatter.
There you go. All right. Well, thank you so much.
You're welcome.
All righty.